Hello guys, this is Dr. Dheeraj Masapu, and are we really wasting significant amount of time in our youth in studying MBBS, MD, and DM and all that? So why I'm doing this video is after finishing MBBS and looking at the statistics, around 40 to 70,000 is what people are earning. After doing MD, around 80,000 to 1 lakh is what they're earning. So this is exactly the kind of amount this gig workers like Swiggy, Zomato, and Uber Eats, Rapido guys also are earning. So what is the difference then? So so basically, why is that happening? If you try to analyze, the problem doesn't lie in the system; it lies within you. It is a mindset problem. So the number one reason what I'm saying is most of the doctors actually think very small. They just that is because we were taught in a different way. We were taught to memorize, mug the things and pass the exams and then follow some protocols in the hospitals, or we'll enter some kind of hierarchical system in a hospital, let it be a medical college or some kind of a corporate hospital or something. We just follow what our boss is telling. So by doing like this, you will become another cog in a big machine, and then you will end up earning that amount of money only. But if you really want to come out of it, then listen carefully what I'm going to tell in this particular video. You have to impact people. Here's what you're listening is right. You have to impact people around you. Let it be anesthetist or an OPD clinician, or you're a surgeon in a corporate hospital or a small hospital. You have to impact people around you, and you have to develop a mindset called as a solution designer, which I'm going to tell you now. The true growth, okay, the true money or true growth in the career will come only when you impact people who are surrounding you, okay, in your hospital or in that particular area. You can only impact when you solve their problem or when you solve the problem of hospital. For example, if you're anesthesiologist, and then what happens is if your particular center is having is known for shoulder surgeries or some TKRs or something, and then the complaint in that particular hospital is that a lot of pain is there in the post-operative period. So if you are a solution designer mindset person, then you will try to identify that during the positioning of the patient some issues that we have to correct that, or in the post-operative you'll introduce a new medicine or a block or a technique which is solving that issue. Then if you really solve the pain in that particular person, then what happens is you can do an audit and show that the pain was like 30% in the post-operative period. Now it has come to 10%. So 20% is a significant reduction that you have done. Okay, so this is one example. Second example is you're a surgeon operating in a big corporate hospital, and then the problem is like post-operative. Some of the patients are getting infected. Then you actually did some kind of audit and root cause analysis, and you identified that some particular type of draping or somewhere there is a contamination, and then you solved that, and that will significantly improve your profile in that particular hospital because patient satisfaction will increase, on total cost of the treatment would have come down, and basically complications, if they come down, you want the best results to the people, right? If complications are there, then what happens is people will go with a poor satisfaction scores. That is not what we want, right? So this kind of mindset you need to develop. Or Dheeraj, you're only telling about bigger hospitals. What about people who are in OPDs? So for example, you're an OPD clinician, and then what happens is you regularly see some people in your OPD. How can you create impact in your OPDs, for example? Then metabolic syndrome is a common problem identified, for example, in your patients. Then what you can do is you can actually conduct monthly one meeting with. You can make a separate WhatsApp group or Telegram group or some kind of app you created, and then you keep all your metabolic syndrome patients or obese and high blood pressure and all that mild breathlessness patients there. And every month you conduct some program for them or some talk with them, with a nutritionist or with some kind of a person who is actually expert in that, and you transform lives of those 100 people. And then what happens is those 100 people will actually uh, become your fans, and then they will go and get more patients to your OPD. So this is the kind of impact that you have to create for the people who are around you. That is what I'm trying to tell. If you do like this, then what happens is organically, for a period of time, your practice will actually go up. So this is what I'm trying to tell you. So excellence and everything I already told in my previous videos, but this is the kind of solution designer mindset is what you need to build. So you have to see the problems where people see the status quo. That is what you have to see and try to solve them. Okay, and then if you're in a system or like a corporate hospital, even there you will be appreciated. Yours is a private clinic or a OPD or a smaller hospital, even there you'll be appreciated. So this is what is creating impact on the people who are around you. Now, then you ask me, Dheeraj, now we did this, but we reached a certain level. After this, how to go to another level up? Another level up you can reach. There are so many other things that you can do. For example, now I'll tell you some high-fi stuff. For example, you developed a software like AI-driven software or something to deal your metabolic syndrome patients, which will constantly send them messages, track their progress, and all that. Even more, they'll get benefited. Or some kind of medical device innovated to solve particular infection prediction risk or something like that. Or you are actually specialized. You made some kind of specialized training program to train your nurses, train your staff, train your juniors in some certain skill set. Okay, the hospital would see that you're actually helping in growing the quality of the department. So these are the next level things that you can actually do to get good name and fame in the hospital where you're working. So these are the kind of things you have to do, and only when you impact people who are around you, where you're working, you can go to next level. That is what we're not doing, because we just mug something and then we write some exams. We'll think that getting some degrees and fancy degrees will actually change things. Nothing is going to change like that. Only when you in the ground level, when you impact people, only then you will cross the barrier and go to next levels. That is what is required at present in India, that we are not doing. Okay, so this is about the video, and if you don't do this, you have wasted your 15 years of education on what you have spent. Okay, because the kind of money that you are earning can be earned by a Swiggy person also. So basically, if you follow what I am telling, you can reach anywhere, like 5 to 10 lakh range. You can cross aram and then you'll have a very comfortable life. So there are some people commenting in the videos. I'm saying it's not about money. It's not about. I'm not talking. Money should come as a byproduct. But when you impact people, you'll feel happy. You'll feel fulfilled. You'll feel energetic, and that is the kind of person you should become. And then by doing that, money will automatically follow you, and then that will provide safety for your family. See, doctors for service, I can understand totally, but something happens to your family, who is going to help them if you don't have money? Think about it. So you are not earning money in unethical ways or illegal ways. Okay, you are earning money by actually helping other people. That is what I am trying to tell you. Okay, so then if you want to actually learn more from me, I can help you with a mentoring session, like one-on-one. I can sit with you and help you build some kind of a thing which helps you in impacting people who are around you. That is what I can do. And then thank you guys for following the video till now, and hope to see you in the next video. If you come to this part of the video, I think you should subscribe, because I think 80% of the people are watching the videos and not subscribing. I think you should, if you come to this part of the video, particularly this part, that means you're a true fan of me, and then you have to subscribe to the channel, and then let's see you in the next video.